Is your child hyperactive, irritable, or plagued with headaches? What's happening at night could affect his or her behavior during the day. A recent study showed that 69% of children under the age of 10 suffer from some type of sleep disorder. Sometimes these disorders can cause behavioral problems. 2 years ago, Sharon Neary noticed a change in her daughter Cameron. Cameron became unfocused and cranky, but it never occurred to Sharon that a sleep disorder was the culprit.
She had a hard time concentrating, she was disruptive during class, and it just seemed to be progressively getting worse. The guidance counselor called me and suggested that we take her to the pediatrician. She believed that she had attention deficit hyperactivity disorder. The behavior seemed to really coincide with that diagnosis. I wasn't really convinced that it was. I thought it was my duty to find out if it could be something else.
Sharon came across an article on sleep disorders in children and decided to take Cameron to a sleep specialist. She learned Cameron suffered from sleep apnea, a condition characterized by interrupted breathing during sleep.
I was relieved that it was sleep apnea, that something could be done about it, and that it wouldn't be a lifelong journey of medications and finding the balance of the medications to control her behavior.
Children can suffer from the same sleep disorders as adults, including insomnia, sleepwalking or talking, sleep apnea, night terrors, bedwetting, or narcolepsy.
The most common sleep disorders in children are the insomnias, which consist of difficulty initiating or maintaining sleep through the night, and obstructive sleep apnea, which relates to snoring and disruptions in breathing during sleep. Insomnia in children can be caused by parents not setting strict bedtime and wake time limits. Oftentimes, insomnia in children can be caused by their biologic sleep clock being out of sync with the rest of society. Sleep apnea in children is typically caused by narrowing or crowding of the back of the throat. That can be caused by obesity or tonsillar enlargement. Sleep disorders in children may be more difficult to diagnose because they may not be recognized as a sleep disorder. Attention deficit, school-related performance issues oftentimes are not recognized as having a root cause in a sleep disorder or problem with sleep.
If you suspect your child has a sleep disorder, learn to spot the symptoms at night and during the day. At night, the symptoms can include loud snoring, noisy breathing, restlessness, bedwetting, gasping or snorting, and swearing. During the day, look for mood swings, daydreaming, difficulty waking up, irritability, hyperactivity, sleepiness, or behavior problems. Today, after minor surgery, Cameron is back to her old self.
Cameron is doing much better after having her tonsils out. She wakes up easily for me in the morning. She's ready to jump right out of bed. She focuses more in school. She's making more friends, and she's able to concentrate on not just her social activity, but her school activities as well.
Though sleep disorders remain startlingly common, the right treatment can help.
I would advise parents that are concerned about sleep disorders in their children to discuss the situation with their pediatrician. They need to know that sleep disorders are easily diagnosed and can be easily treated and can lead to significant improvements in the overall well-being of their children.
My advice to parents with children with behavior problems would be to try to seek an alternative diagnosis to ADHD through a sleep study. Cameron is thriving. She's doing so much better after her surgery. She's able to concentrate in school and doing much better with her activities.
The Sleep Center at St. Francis Medical Center delivers quality, comprehensive care to children and adults with sleep disorders. At this state-of-the-art sleep lab, patients are provided with private rooms, weekend studies, and accommodations for the parents of pediatric and adolescent patients.
To provide an accurate diagnosis of sleep-related disorders is our ultimate goal, both for adults and for children. In adults, it helps us able to manage their chronic problems that could be secondary to a sleep disorder. But for children, it's also important for their parents to have answers to perhaps why are there behavioral problems in their child that may be related to a sleep disorder.
At the Sleep Center, patients get complete care from diagnosis to treatment.
The care at St. Francis Medical Center was excellent. They explained everything before they did it so that it really put our mind at ease.
Thanks to the Sleep Center at St. Francis Medical Center, more children will get a restful night's sleep. The Sleep Center is just part of a long tradition of quality care at St. Francis Medical Center. Since 1874, the professionals at this hospital have provided superior medical attention and convenience to the underserved communities surrounding Trenton, New Jersey. First run by the Sisters of St. Francis of Philadelphia, St. Francis Medical Center is now the area's regional referral hub.
The mission of St. Francis Medical Center is consistent with the mission of our founding sisters back in 1874. We are a community of persons dedicated to gospel values to be a transforming, healing presence in the communities that we serve. We treat all people with care and compassion, with a preferential option, though, for those who are poor, marginalized, or underserved in our community.
With state-of-the-art facilities like the Sleep Center, St. Francis Medical Center will continue to be the premier healthcare resource in the greater Trenton area.
Our future here is to really continue to meet the ever-changing healthcare needs of the communities that we serve. We will grow as a regional referral center for the complex diseases of the heart and cardiovascular system. And at the same time, we want to promote resources to our community that will really help maintain the health and welfare of the communities we serve by providing a lot of adequate resources for primary care, preventive care, and other measures that we can provide to this community so that they remain as healthy as possible.